As we get older, our lens changes and the clear lens that we were born with turns a little bit more yellowish. As this yellowish lens affects our vision, you tend to have symptoms such as glare, decreased vision, sometimes halos around lights at night. This can all affect your activities of daily living, such as driving, watching TV, even reading a newspaper. Usually the earliest signs for cataracts are halos or glare around headlights at night. When you start to see that, then you want to come in for a cataract evaluation. During the evaluation, we will examine your eye, check your prescription, check your vision, do tests to measure your intraocular lens implant power if need be, and dilate your eyes just to make sure that you don't have any other conditions that would account for your decreased vision. The surgery is a relatively quick outpatient procedure that is performed at our surgery center. Using the latest technology, we can remove the cataract through a very small incision, approximately 2.5 millimeters in width. The procedure involves making a small incision in the cornea and removing the lens using ultrasound energy. That process takes approximately 10 minutes and is done with very mild IV sedation. We use numbing drops rather than putting patients to sleep, and their eyes kept numb throughout the procedure. The anesthetist gives you medication through the IV to keep you comfortable and relaxed, but you're awake enough to respond to all commands. And the nice thing is that after you're finished with the surgery, you're actually alert enough that you could resume most of your normal activities later on that day. The recovery after cataract surgery is relatively straightforward. You leave the center with a shield over the eye, and you start drops that day and you continue them for 3 to 4 weeks. The key points are not to bend over and lift anything heavy for about 2 weeks, but you can resume your normal activities pretty much the day after surgery. Patients are amazed at how well they can see the evening after the surgery, and while they have to keep a shield over their eyes, some may even see well through the small holes in the shield, and by the next day they've recovered almost 80 to 90%. The shield is there to protect your eye from being rubbed, so keep it on for about a week after the surgery. But aside from that, most people return to work the next day or even 2 days after the surgery.